Health Edge, a mammogram is a woman's best tool against breast cancer. With early detection, most breast cancers can be cured. But what about the 5 million American women who have breast implants? Have they limited their chance at dependable early detection? Felicia Robinson had breast implant surgery in March, and she had questions about her cancer risk.
My grandmother had breast cancer. She had to have a mastectomy, and then 2 years later, she had to have the other breast removed with breast cancer. So it was a concern of mine.
Her plastic surgeon, Beaumont's Dr. Anthony Youn, laid out the facts.
Breast implants have actually been proven by studies not to increase the risk of breast cancer. And on top of that, it also does not delay the diagnosis of breast cancer. And if breast cancer is found in some way with breast implants, it does not worsen the prognosis.
But that doesn't mean there aren't things women need to know.
They will technically lose a little bit of what they can see on the mammograms, even with the extra photos.
Women with breast implants will probably need to have their breast x-rayed from additional angles.
They will likely need to take a couple of extra x-rays in order to maximally visualize the breast tissue.
And self-exams are a little different too.
The plastic surgeon can show you what's the difference between the actual breast tissue and the implant, and even show you how to move the implant aside to feel the breast tissue so that you can really feel as much as you can.
For women with additional cancer risks, the placement of the implant should be considered.
Some people recommend putting an implant actually underneath the pectoralis muscle or the chest muscle, and by doing that it helps to push the breast tissue upwards so that a mammogram can actually be seen better.
Felicia has kept up with her self-exams and is scheduled for her annual mammogram later on this month. She's happy with her implants, but her first priority is her health.
If you're not going to take care of yourself and have your physicals and the mammograms, I wouldn't consider doing it.
Yeah, don't forget your mammograms. Now, the most common problem with implants is capsular contraction or scarring. That can make mammograms more painful, less accurate, or even impossible. In those cases, an MRI will be necessary to screen for cancer. Robbie?